This is Northwest Focus, a public affairs presentation of KNMT. Opinions expressed on this program do not necessarily reflect the views of KNMT or the Trinity Broadcasting Network.
Hello, and welcome to Northwest Focus. I'm Cathy Rhodes, your host. Our topic today is health. We're going to be talking about diabetes. We have here in the studio with us today Dr. Tillett, and Dr. Tillett has been practicing in podiatry for over 15 years. He's also the Chief of Podiatry for Legacy. Welcome, Dr. Tillett.
Thank you. Thank you for having me.
Yes, it's a pleasure to have you here today. Now, we're talking about diabetes and neuropathy. Tell us a little bit about why this is such a big health issue today.
Absolutely. There's so many patients that are even undiagnosed, but even those who know that they have diabetes, the feet become almost like a window to their health. They have so many problems that affect various systems of their body. It affects their vascular system, so their circulation, their ability to heal. It affects their nerves, and that becomes a really big, important thing with feet, because oftentimes patients will come into my office with a various foot condition, and I look at it and put the pieces together, and we find out they actually have diabetes.
Really? And so a lot of these patients that come in, they don't know that they have diabetes yet.
Absolutely.
That's what it sounds like.
They estimate, the American Diabetes Association estimates over 10 million people in the United States don't know they have diabetes, and they have it and just undiagnosed yet. That's
amazing.
Yeah.
That's amazing. So what is it about diabetes that is so silent? What about it, let's talk about the symptoms and why people don't recognize that they have it.
Great question. Probably the biggest thing that affects their feet is nerve damage. And, our nerves are very important to us.
Right.
In our feet, when we stand, we get little hot spots, I call them. So our feet say, wait a minute, adjust your posture a little bit one way or the other, because I need some more circulation over here. When they begin to lose the sensation in their feet, which is called neuropathy, they lose that sensation, they no longer get those signals. If they have a bad pair of shoes that rubs a little bit on a certain area, causes a callus or enough friction to cause a blister, their foot is not telling them,
wow,
I'm being bothered, you need to change what you're doing.
So about how long does it get ignored typically? So if someone is having poor circulation, they're suffering from neuropathy but may not know, how long would it be before they start to have some really serious symptoms and side effects of that?
Unfortunately, sometimes those patients come into my office with a sore on their foot or a hole in their foot that's infected, that we're looking at surgery automatically is the first thing we can do to treat it. Fortunately, we have a lot of people that are very health aware and maybe search the internet for good sources and realize that something's not right, I need to talk to my physician. And so they recognize that just something's not right, maybe not, there's a sore on my foot.
Okay. And so for people that do come in and let's say they do find out that they have a sore or that they might need to have some kind of a procedure done, are there stereotypes associated with diabetes and maybe amputations that may delay someone from getting the treatment they need?
Oh, absolutely. I hear it all the time. Patients relate what they've heard from maybe a relative or a friend that I've not come in until I got really nervous because this or that, but I keep hearing that don't let them treat it, don't let them whittle on your foot, because if they amputate one thing, they're going to keep whittling on your foot and you're going to pretty soon lose your leg.
Okay, and that's simply not true.
Absolutely not true. In fact, most of the time, if we catch a young diabetic and take care of the infection, which I guess the bottom line, the truth is, certain infections that are in bone, cannot be treated with antibiotics. That piece of bone has to be removed.
Wow.
Now, we do use antibiotics frequently to treat infections, but that's where the amputations come in. And so frequently with a young, healthy diabetic, if they have an amputation, we create a functional foot for them, and they live a long, healthy life if they continue to treat their diabetes, live healthy so they protect the rest of their body. But now the other patients that we end up doing amputations on who don't control their diabetes, and they end up with sore after sore, it's usually that it's so late, it's an indicator of how bad their circulation is, so that if they get a small sore, their circulation isn't getting down to fight that infection. So unfortunately, sometimes it is beginning to whittle and we take more and more, but that's because they've gotten to the point where their systems are so bad.
Right.
And you know, an ounce of prevention could go a long way. If you catch it earlier, treat it sooner.
Okay. So for someone who controls their blood sugar levels more inclined not to encounter maybe circulation issues with their feet versus someone who is not managing their blood sugar levels effectively?
Absolutely. Absolutely. There's an absolute direct correlation. High blood sugars over a longer period of time, and they kind of range and are able to assess what an average sugar is for an individual. And when that individual's blood sugar stays high for quite some time, it actually draws the fluids out of the nerve cells, and they basically dehydrate and die. And so then they begin to lose that. So if you can maintain good blood sugars, you protect your nerves.
Okay. And so let's talk a little bit about prevention. So you said that the person who is suffering with neuropathy and they don't have the circulation little warnings or triggers that the rest of us have. So what are some things that they can do to keep the circulation moving and monitor what's going on? That as well.
Okay. I think it's just important, first of all, to stay active and healthy. Monitor your blood sugars. And so that we know where we're at, it's important to monitor those blood sugars. It's easy and understandable to want to ignore it and out of sight, out of mind, but the better we control them, the better off we are. As far as preventing, it's really checking our feet daily. Get a family member or someone else to look at our feet, look for changes. If anything else, just look for changes and have those addressed. We're looking for major sores or big problems, but also just the little color changes or just a little callus, because a callus can lead to a big thing.
Okay, so actually doing that visibility check, having a family member or caregiver do that is very useful.
Extremely. Our eyes get affected with diabetes, and that's one of the things that make it difficult for patients with diabetes to check their feet is their eyes aren't good either sometimes.
Right. Now you had mentioned that the large number of cases of diabetes. Why are we seeing so much diabetes now? Why is there such an increase?
There's a few different schools of thought. You know, some say that it's lifestyle, and but we also know that there are genetic factors. Maybe the lifestyle contributes to those things. It may make it manifest earlier. So it is smart to live a healthy lifestyle and prevent that. But the genetics are the bottom line. So if we can prevent it, we can hopefully postpone it for a long time or maybe even indefinitely.
Okay. So if you know that you're genetically predisposed to diabetes, you should really
stay active
and do
walk,
some,
run, walk, do those things, monitor your blood sugars, eat healthy.
All of those things help. Now what about shoe care, or shoes?
Shoes.
And foot care.
Oh, I love talking about shoes.
Let's talk about shoes. Does it make a difference, the type of shoe that a diabetic person would wear?
Absolutely. So we monitor diabetic feet, and once they become at risk, meaning they're showing signs of a little bit decreased sensation, we have to watch what things could be rubbing on their foot. Because if they begin to get a callus, which 85% of diabetics with a callus lead to an amputation.
Wow.
I don't know if I quite said that right, but 85% of amputations start out as a callus.
Start with the callus.
So the diabetic shoe, I happen to be wearing one
because
it's beautiful.
That is a beautiful shoe, I have to say.
They have a bad reputation for not being a good-looking shoe.
Right. Well, that's a good-looking shoe.
Thank you. There's a few special things about the shoes. They're deeper, they're wider, they have a special insole that protects their foot from pressure, so they don't develop the calluses and they don't have any seams. So even though there are seams around the shoe, there are no seams on the inside because they're lined, because that may rub on their foot. And if it were rubbing on your or my foot, it would bother us. But a patient with no sensation, it'll rub a hole in their foot before no time.
Wow. Okay, so it's important to get a good diabetic shoe. And what about socks? Do socks matter at all? They're
very important too. The same things have to be considered. They do make diabetic socks that actually are double walled, so that there's no friction on the foot, and that's very important. It's going to cause the same kinds of problems.
Okay, so that shoe could be good for someone with diabetes, or even someone that maybe may have a history, a family history, or just healthy feet.
I'm not diabetic, but I wear it just because it's sexy and I like it.
Okay. Well, let's talk about treatment. What kind of treatment options are out there for people that have neuropathy issues with their feet?
Great question. For decades, that's been a problem. About 11% of patients actually have considerable pain with neuropathy or nerve damage. And the only treatments we've had are either opiates, which are addicting and they affect our lifestyle, and patients can't think clearly. But the other treatments have been those that treat other psychological conditions. Seems kind of strange, but all we have is a group of medicines that treat anxiety or bipolar, and these types of medicines that we use, or primary doctors use, to try and help the nerve pain reduce. And that's all we've had. You know, recently there have been companies that have developed new medicines, and it's really unique. They've taken vitamins and turned them into the active form.
Vitamins?
Vitamins. Like vitamin D needs sunlight to become active.
Right.
These vitamins need to be turned into an active form. And what they found is you take these folic acid, B6 and B12 in particular, make them active, and when we take them, they are absorbed 7 times better.
That's amazing.
So rather than 56 pills a day, you can take 2 pills a day, and patients are actually getting restoration of the nerves. Actually took biopsies from patients that had neuropathy, and they could look in a microscope and say there are 1.5 nerve endings in every square millimeter. After 6 months of taking this medicine, they did the same thing to those patients, and they were up to 3. So actually doubled their nerve endings.
That's amazing. So it kind of reverses the damage, the nerve damage.
Yeah, and that's just unheard of. It just never has been before. I have patients that have astounded me that have actually gained complete sensation back from having no feeling whatsoever.
Wow, wow, that's amazing. Are you finding any new studies or research in relation to diet as well?
You know, it's almost that they keep reproducing different studies that keep showing the same thing.
Okay.
Bottom line, eat healthy, think forward, and keep your blood sugars under good control, and you're going to be much better off.
Okay. Well, we've got just about a minute left, and you've given us a lot of really great information. Is there anything additionally that maybe you can talk about in regards to people that do have maybe people in the family that are elderly with diabetes, or maybe younger with diabetes? What can be done to provide support?
Not only to help them check their family members' feet, look for any problems, introduce them to a podiatrist who knows the problems with the feet. 65% reduction in amputations by having a podiatrist follow your feet.
Thank you so much, Dr. Tillett. It's been wonderful talking with you. I know I've certainly learned a lot of information that I'm going to practice. And thank you so much, viewing audience, for tuning in. We do look forward to seeing you next time on Northwest Focus.